Alzheimer's disease. How has this disease been understood? What have people thought caused the disease, and how did they come to that conclusion? And how has that changed or not changed over time? At first, when the mysterious cause of the severe memory loss and worsening psychological changes was being researched, professors like Emil Kraepelin were positive that any mental disturbances were all caused by one thing: the connection of psychopathological observations to microscopical studies of the brain. Because of these studies, it was believed by Alois Alzheimer and his colleagues that this disease was always caused by cerebral atherosclerosis. They used research methods such as those of Franz Nissl, who took cerebral tissues for microscopic studies and inserted substances like alcohol into them to study them. In 1898, Alzheimer started to doubt that cerebral atherosclerosis was the cause. He began to examine younger patients that were showing symptoms of this disease. He found that some of these patients had no atherosclerosis changes, but still were losing a large amount of neuronal cells. In one of his most famous studies, Alzheimer researched August Dieter. She was 50 years old and in a mental hospital. She exuded behaviors of those of a lost toddler, as she would cry out for her family and start to cry when she didn't understand questions that were asked of her. She had extreme memory loss and was becoming delusional. She eventually became mute and died in 1905. After she died, Alzheimer performed an autopsy and found shrinkage and abnormal deposits around the nerve cells in her brain. In all of these patients, the research pointed towards amyloid or senile plaques and neurofibrillary tangles being the actual cause of dementia. He found that the senile plaques could also happen in younger people and were not always a cause of old age. He thought they seemed to be related to a hereditary predisposed condition instead. Has there been any change in the way that the disease has been defined? Have different symptoms been attributed to this disease? Emil Kraepelin, one of Alzheimer's coworkers, had come up with two categories of diagnoses for all general symptoms that relate to mental illness, and they were dementia praecox and manic depressive illness, like we learned in Module 3. At this time, even though similar psychiatrists would put someone with the symptoms of Alzheimer's disease in the category of dementia praecox, there was little to defer it from any other disease, causing misdiagnosis. Mental disorders were so inconsistent to diagnose in the early 20th century, there was little to correctly differ the dementia and the psychological demise of Alzheimer's from, say, schizophrenia. Schizophrenia was an overdiagnosed disease, and it was often diagnosed to anyone that appeared to be deteriorating or delusional. Since this time, there have been many clarifying studies that have solidified the specifics and the definition of Alzheimer's disease. In 1968, a measurement scale was implemented in order to estimate how much damage to the brain had happened so far, just by looking at the severity and the number of symptoms. After advancements in technology such as the electron microscope, researchers were able to discover beta amyloids in 1984, which were the biggest component in forming the plaques in the brain that Alzheimer himself talked about 60 years before. 2 years later, another protein in the brain that caused degeneration of the nerves found in Alzheimer's was found, and it was called the tau protein. In the decade after, scientists found a gene that determined the risk factor of Alzheimer's, and they discovered the gene from which beta amyloid is formed. How has the disease been treated by the medical community? What treatments have doctors prescribed, and has this changed in any way over time? Ever since its discovery by Alois Alzheimer and its naming by Emil Kraepelin in 1910, the medical community has taken it very seriously. Researchers have used all of the newest advancements to continue their research for a cure. In 1974, the National Institute of Aging was created and is the primary government support for Alzheimer's research. They founded an Alzheimer's Association in 1979. It is the primary source of caring for those with Alzheimer's and helping them with research and treatment. There have been many drug trials and clinical trials since, as well as testing mice with vaccines that had been injected with the Alzheimer gene. Recently, President Obama put the National Alzheimer's Project Act into play, which created a strategic plan for the U.S. to address this crisis, and funding for research has since greatly increased. When Alzheimer first was discovering this disease, he only had more natural treatments that are now known to not do anything to help, such as warm baths, cool head wraps, or hypnosis. One of the treatments that is most prevalent today is trying to prevent it early on, with preventative trials first. Once the disease has progressed far enough, there are early symptomatic trials, preclinical drug studies, and then more aggressive trials. So far, nothing has completely stopped the disease, and the trials have failed. But researchers say that they are hopeful, since lots of diseases have started off with failed clinical trials, but ended up in success, such as AIDS or certain forms of cancer. There have also been many drugs approved by the FDA over the last 3 decades that are supposed to help slow memory loss and to target Alzheimer's symptoms. On top of that, there are many diets that doctors will prescribe that have shown to make getting the disease less likely, or that can at least slow the progression of it. There is currently no absolute cure, though. How has the disease been understood or viewed within society, and has this changed over time? Before the discovery of this disease, patients in psychiatry facilities were looked down upon and considered shameful in the family. While Alzheimer was studying his patients, he treated them very well and even made sure that his patients would stay in a good place with lots of care, even if they could not afford it. This was not common for them to be treated so well at the time. Over time, awareness of the disease and more research on it made it less of a shameful, taboo topic. One of the biggest progressions in raising awareness and acceptance was when President Reagan decided to announce his diagnosis with Alzheimer's. When sharing this with the country, President Reagan wrote, "In opening our hearts, we hope this might promote greater awareness of this condition. Perhaps it will encourage a clearer understanding of the individuals and the families who are affected by it." This not only made it an easier topic of conversation, but it also helped progress research and funding for this epidemic. Soon after, there was a National Alzheimer's Day created on September 21st, and many more efforts have been made to try to support those with this disease. Even with all of this awareness, though, it is still one of the most feared diagnoses for patients and family. This is because even though it may not be the leading cause of death in America, it robs the patient of certain human dignities, such as remembering their own families or control over their emotions. I have been close with 2 patients that have been diagnosed with early onset Alzheimer's in my life, and I know that it can be extremely hard on the patient and their families because it can be humiliating for the patient and difficult for the family to see someone they know and love change so much. It is definitely important for the patient to have a consistent and reliable support system throughout this heartbreaking disease.